The PADIS guidelines recommend a structured approach to managing pain and sedation in critically ill adults. In this presentation, we will discuss the different sedation strategies aiming to improve outcome in critical care patients on mechanical ventilation. The guidelines recommend an analgosedation with analgesia first, or analgesia-based sedation, a light sedation compared to deep sedation, and the use of dexmedetomidine or propofol over benzodiazepines among the available sedative agents, in the management of critically ill patients on mechanical ventilation. Analgosedation refers to a sedative minimizing technique, utilized to manage both pain and agitation in critically ill patients who are mechanically ventilated. The primary objective of analgosedation is to prioritize pain control through analgesia before considering the use of sedatives. This strategy can be broken down into two types. First, analgesia-based sedation, where analgesics replace sedatives to achieve the desired level of sedation. Essentially, the pain control medication itself helps to keep the patient calm and comfortable, without the need for additional sedative drugs. The second type is analgesia-first sedation, where analgesics are administered before sedatives. If the analgesic agent alone does not achieve the desired level of calm and comfort for the patient, sedatives are then used as a secondary measure. A pooled analysis of multiple studies has shown that a protocol-based analgosedation approach lowers sedative needs, reduces the duration of mechanical ventilation and ICU stay length, and decreases pain severity compared to usual therapy. However, a conditional recommendation was made, as benefits were not seen across all critical outcomes. A strategy of light sedation is recommended in the guidelines compared to deep sedation in mechanically ventilated ICU patients. No clear definition of light sedation, however, a RASS score of -2 to +1, or its equivalents from other scores, were used in different trials. Light sedation is preferred in most critically ill patients who require mechanical ventilation. However, in certain conditions such as status epilepticus, neurological injury, intracranial bleed, post-cardiac arrest, high ICP, or paralysis, a deeper level of sedation is warranted. Daily sedation interruption protocols and nursing-driven targeted sedation protocol can achieve and maintain a light level of sedation. The recommendation of PADIS guideline for using light sedation is conditional and based on low quality of evidence. Light sedation was associated with a shorter time to extubation and a reduction in tracheostomy rate. However, the studies didn't find an association between light sedation and 90-day mortality, delirium incidence, PTSD, depression, or self-extubation. In terms of the choice of sedatives, the 2018 PADIS guidelines recommend using propofol or dexmedetomidine over benzodiazepines in mechanically ventilated ICU patients. This recommendation is conditional and is based on low level of evidence. This slide shows the trials upon which the recommendation was made. As you see, the results of multiple trials revealed improved outcome of using propofol or dexmedetomidine over benzodiazepines, including shorter time to extubation, reduction in mechanical ventilation duration, and more delirium-free days. Also, the guidelines recommended using dexmedetomidine in agitated patients prior to extubation, where agitation is precluding successful extubation. This recommendation is based on a small randomized controlled trial with a total of 71 patients that showed an increase in median ventilator-free hours in the dexmedetomidine group compared to placebo. It is worth to mention that after 2018 PADIS guidelines, the published SPICE-3 study aimed to investigate the effect of dexmedetomidine as a primary sole agent in mechanically ventilated ICU patients on 90 days mortality. The study included a total of 4,000 patients, and concluded that dexmedetomidine was insufficient alone as the primary agent to achieve clinically desired target sedation levels, and was associated with more reported adverse events than usual care. In summary, PADIS guidelines recommend using analgesia first or analgesia-based sedation strategy before starting any sedative agents. A light sedation strategy with RASS score of 0 to -2 is recommended using dexmedetomidine or propofol, with daily sedation interruption or nursing-driven sedation protocol. Dexmedetomidine is also recommended for delirium where agitation is precluding weaning and extubation. Thank you for watching.